My name is Flora Yousefian-Tehrani. I am the program manager over the Mental Health Services Act innovation projects in Orange County. I've been with Innovation since 2011 and have seen plenty of innovations come and go, and I'm super excited to share with you this latest and greatest one. So with that, I will go to the next slide and review our learning objectives. So in this session, I will share with you a very brief overview of the statewide Help at Hand innovation project, and specifically Orange County's implementation of a technology-based mental health support app. We will spend the majority of our time talking about lessons learned and key takeaways. Let's get started with talking about the Help at Hand project overview. Help at Hand is an innovation project. For those of you who may not be familiar, innovation is one of the components under the Mental Health Services Act and specifically focuses on evaluating new or changed approaches to the behavioral health system of care. The primary goal of an innovation project is learning, with the ultimate objective of transforming the system. Help at Hand was the first multi-county innovation project, which at its peak included 14 participating counties and cities that you see on the map here. Together, we represented large and small counties, urban and rural locations, each with our unique target populations that truly captured a statewide effort. Our counties partnered together through CalMesa, who served as the fiscal intermediary and project manager. CalMesa supported the contracting process for the counties and helped navigate the identification of qualified technology vendors and apps. This provided the counties with options of selecting an app that best fit our collaborative project goals, as well as our unique local needs. Our collective goals were to explore the integration of mental health-based apps into the county system, to learn how these public and private systems can seamlessly integrate and work together. We also wanted to promote shared learning, where activities in one county's efforts can rapidly expedite or inform another county's process or implementation. This project provided the opportunity to learn not only about how to implement technology across our different systems, but also how technology can support our diverse communities. By creating this space for integration and shared learning, we aimed to increase access to services for individuals in our communities. They say there is an app for everything, and there are so many options for mental health support, even more so now as the pandemic encouraged and at times forced us to engage with technology and digital platforms. The Help at Hand project was truly ahead of its time as we explored how we could bring support to someone at their fingertips to use when they want or need it most, and in a space where they feel most comfortable. Under this project, each county had its own implementation plan. This slide only reflects Orange County's approach. Of the list of apps that were available to us at the time, Orange County implemented an app called Mindstrong Health Services. Mindstrong was a smartphone app that focused on providing 24/7 access to crisis support and counseling and support services via phone or in-app texting. We selected this app based on an extensive review of our community and program needs, consumers' needs and access to a smartphone device, and the county's ability to support this type of technology in our system. Aligning all of these factors was critical to our selection. As we moved into implementation planning and readiness, our focus shifted to managing any potential risks, with consumer needs and safety being at the core of every decision we made. Our plan involved a slow and methodical approach. We wanted to start with a small pilot site at an outpatient psychiatry clinic, where we could implement the app and continuously evaluate and improve the integration and implementation process. To support this approach, we identified a project champion from the site who was excited about this opportunity and dedicated to integrating Mindstrong into their daily operations, which included their electronic health record system. This champion was also very committed to training and onboarding his behavioral health providers. Introducing something new into a system that has its established processes and workflows can be very challenging because systems and people are typically resistant or reluctant to change. With this potential barrier in mind, we wanted to first understand the existing processes of the pilot site, as well as the technology vendor and their services. Things like, what was the enrollment and referral process like for each of them? How did they interact with consumers? And where were the opportunities to introduce and inform consumers about MindStrong services? The purpose of this approach was to identify how we can implement this app with minimal disruption to the daily operations of the pilot site and the MindStrong technology services. The graphic on the right illustrates the workflow that we established. Again, with the consumer at the core of our approach, the pilot site or referring partner identifies someone who meets eligibility for MindStrong services and makes a referral. We as the county wanted to ensure that each individual was informed about the time-limited nature of the project, potential costs to the consumer, if any, and additional information about MindStrong that we learned were not covered in MindStrong's enrollment process. Once we received an individual's consent, they were formally referred to MindStrong for enrollment. During the first 2 years of implementation, we learned important lessons about our referral approach and determined we were ready to expand to other areas within this outpatient system, including offering MindStrong to their primary care patients, emergency department, and inpatient program. Eventually, we expanded to a much broader population, offering MindStrong to individuals who came through the National Mental Health America website and screening process. As with any innovation project, we had a maximum timeline of 5 years, which began in April 2018 and will end in just a couple of weeks in April 2023. There was so much more we wanted to do, for example, expanding to community colleges, but we were faced with barriers like time and staffing resources that were needed to required to set up this process. I know that was a lot of information in a brief amount of time, but what I really wanted to share with you today are lessons learned from our implementation that we as Orange County now carry forward into all of our projects, whether they implement technology or not. Next slide, please. The first is determining technology fit. I mentioned some of the factors that led to our decision in selecting MindStrong as our technology. It included research, review, and in-depth understanding about the app, the services it provides, and who those services were intended for. The key to understanding and acknowledging is that MindStrong was an off-the-shelf product, meaning they already had a business model for providing their services. We as the county couldn't change it in any way to make it fit our needs. We needed to make sure that the app, as it existed, aligned with our community and consumer needs. We asked ourselves, are these services needed in our county? And to what extent can the app or its services, as they exist, meet the demand or need? An added layer to this is whether it aligns with the county system, especially if the technology or its services involve handling a consumer's protected health information or any personal identifiable information. If it does, which MindStrong did, then IT security needs to involve very early on a security review to assess whether all safeguards are in place before anything can even be implemented. And finally, ensuring alignment with the county program. I mentioned earlier that change is hard, and when you're introducing something new or different into a program that is overwhelmed or staff that is burnt out, it will not be successful. Before you start, you have to look at everyone who would be involved and their capacity to support this change. So a few key things to consider are the time it takes to determine whether the technology fits these different areas that we talked about, the effort it will take for the security, compliance, or any risk management reviews, and the different departments and support systems that need to be in place to help make this implementation successful. Another key lesson is identifying appropriate staffing by looking at the existing staff and their skill sets, leveraging resources where possible, and determining areas of need. For those of us in the behavioral health field, technology is not at the forefront of our knowledge and experience. We know how to use our smartphones and other tech devices, but this project required so much more in terms of understanding the lingo and the back-end administrative side of the technology world. Having someone on the team who had an understanding of this world was a tremendous asset and served as the bridge in communications between the public and private systems. We also knew we needed to leverage resources from various county departments, including quality management, communications, compliance and risk, legal, contracts, fiscal, and IT security. Before or because MindStrong provided therapy, we also knew that we needed staff with clinical background and experience to support discussions around the app and its services. We also relied heavily on peer support specialists for their insight and experience in providing a recovery-oriented approach in our implementation and communications. A project management team was also contracted to support implementation planning, establish processes, and coordinate with all project partners. And of course, we had our project champion who created the environment and space we needed to make this a success. We would not have been able to move forward without the support. For any innovation project that is meant to transform the system, this work can't be done independently or in a silo. It truly takes a village. Being in a county space, I know how challenging it is when we wear so many different hats and struggle to just get through the day sometimes. It is so important to consider staffing before starting any kind of project, leveraging those existing resources from the county departments, and contracting with external subject matter experts to support the different roles and fill in the gaps in our system. The most important thing that got me through a big project like this was knowing that I wasn't doing it alone, and I had an army of people to support me throughout the way. Evaluation is the most important piece of any program and should be the starting point of any new project because it serves as the roadmap for implementation activities. You want to identify the specific data that is currently collected in the program, consider other types of data that aren't being collected that should be, and determine measurable outcomes you're striving to improve. Once those are identified, you need to align this with the type of data the technology vendor collects and can provide. Important questions to ask are whether they're able to collect all of the bits of information that you need and whether they're willing to share that data. Collecting and sharing are two different things, and sometimes a data use agreement is the best way to make sure you bridge the gap between what they collect and what they're really able to share with you. Finally, there should be a plan for how the information will be tracked. Will it be manual? Will it be automated? And in what secure formats will the data be exchanged? Equally as important is determining who should have access to viewing this information. To minimize risk, it should be viewed only by those who have a business need. And again, this is where you rely on your support team and make sure that contracts are engaged as soon as possible and looped in so that the appropriate business associate agreement, data use agreement are in place for the levels of data exchange that you need. Once set up, the evaluation plan not only becomes your guide, but paves the way for improvements and documents key learnings for future implementations. Another key area to consider before getting started with any implementation is assessing operational readiness. This is really about understanding the policies and procedures within existing systems of the county, the pilot site, and the technology vendor. What are the workflows that you need to create? And do any of them need to be adapted to fit with the existing policies or to fit with what you need the program to do? For example, the MindStrong app provided crisis support. We needed to understand the existing procedures for our county crisis response program and make sure the technology vendor was able to respond according to our protocols. Again, with any exchange of information, you need to make sure the appropriate contracts and business agreements are set up, IT security has been reviewed and approves the technology, and compliance and risk are aware and on board of the implementation plan. You also want to make sure that the workflow, including any automated processes that were created to support efficient implementation, are functioning the way that they should and need to continuously monitor those to determine whether it needs to change or be updated. Next slide, please. This one probably isn't a surprise, but it is critical to establish ongoing communication throughout every step of the project, whether you're in the initial planning phase or the actual implementation. This is especially important when two separate systems like public and private entities come together. We may have entirely different languages and acronyms to learn. Even more challenging is when we have similar terms like serious mental illness or peer support. The danger in that is that we assume because we're using the same terms, they mean the same thing, when in reality, they could mean totally different things because we're talking from our own respective worlds. Finding mutual understanding and agreement on terms early on will prevent miscommunications in the future. Effective, positive communication can be established through frequent planning and implementation meetings with all project partners, consistent documentation and sharing of materials to ensure everyone remains up to date or can reference the information at a later date, and building in opportunities to hear from the consumers or the behavioral health providers, those who are actually on the ground receiving or providing the services. These can be critical insights into improving our project implementation. Finally, as you implement, be open to change and ready to adapt. Expect that things will likely need to change as you gain insights along the way. This is a necessary and critical part of anything new that you introduce or any kind of change. In thinking about our goal of integrating technology into the county, our counties are highly structured in our system. We are set in our ways and sometimes very deeply ingrained in those processes. But when you think about technology, it is highly agile and can change in an instant. So this can be very challenging and frustrating for both partners and require a lot of strategic planning and workarounds to resolve. When implementing technology, it's important for both partners to understand each other's processes and timelines and work together in response to changes. For example, any change in how Mindstrong communicated about their product, like their logo or description of their services, required us at the county to update our brochures, our flyers, training materials, and even the informed consent. Those then had to be vetted by our peer specialists, clinical staff, project champion, county communications, compliance, and even sometimes our legal department. Once we had a final version with full agreement, it then had to circle back to Mindstrong to make sure it still aligns with their messaging. So one minor change created this ripple effect that required a tremendous amount of time and resources, in addition to the rapid response to update all the project materials and communications. So knowing of changes and being ready for those changes is the fastest way and most efficient way to prepare all of your resources to do what we need to do to update the materials. And finally, we learned early on that with so many departments involved and activities that overlapped, we needed more time and resources than expected to manage the workload. But we also learned that completing tasks in parallel rather than in sequence helped expedite a lot of the activities. So for the IT security review in Orange County, it can take a minimum of at least 6 months to go through that review and approval process. But knowing that, we started the process early and then diverted our time and attention to other areas of the project, like learning more about the processes at the pilot site, knowing about their daily operations, learning about Mindstrong, looping in compliance and talking about the consumer risk and safety, creating our project materials. All of these efforts were done while the security review was still underway, so that once we got that approval, we knew that we had other things in place and could move forward rapidly. So this slide is just a summary of everything that we've covered. I could share so much more about the valuable lessons we learned in this project, but I really just chose the most important areas that we, Orange County, continue to take with us in all projects moving forward. The experience we gained in Help at Hand has shown us how to effectively partner with private organizations and integrate technology into our system in a way that has really changed the way that we use language in our contracting and write out our scope of work and really kind of move forward in our contracts. I hope that you found these insights helpful in your own work